Today we are going to start lecture on stroke. So what is stroke and what is hemorrhagic stroke and how to manage a patient of having hemorrhagic stroke? Now we will discuss today in detail. So what is stroke? Stroke is any patient having sudden onset focal neurological deficit which is due to vascular causes stroke. जो एकदम अचानक से हो, सडनली हो, एकदम से, और any focal neurological deficit which is due to vascular cause. Focal neurological deficit depend upon which area of the brain is involved, whether it is frontal lobe, whether it's parietal lobe, whether it's temporal lobe or occipital lobe. ब्रेन का कौन सा लोब इन्वॉल्व हुआ है, कौन सा हिस्सा इन्वॉल्व हुआ है, डिपेंड करता है कौन सा सिम्टम पेशेंट को मैनिफेस्ट करेगा. तो फॉर एग्जांपल, and it should be due to vascular cause. So what is stroke? It should be sudden onset. It should be abrupt at onset, maximum at the onset of symptoms. And it should be due to vascular cause. Due to vascular cause. And vessel, blood vessel there can be thrombus or there can be occlusion of blood supply. There is thrombus and the blood supply is cut off. Blood is not going to any part of brain due to blood clotting. There is clotting. Or it can be due to bleeding. Brain blood vessel is rupture. So this is vascular cause. So for stroke, there should be three things. It should be sudden onset. It should be vascular cause. Either there is blockage of vessel or either there is rupture of vessel. Depending upon the area of the blood supply which is compromised due to vessel blockage or vessel rupture, any different part of the brain can be involved. So patient can have sudden onset weakness on one side, sudden onset sensory symptoms on one side. Patient can have difficulty in sudden onset slurring of speech, sudden onset double vision, depending upon which area of brain is involved. So how we will suspect clinically patient is having stroke? If patient is having sudden onset balance difficulty, patient can have sudden onset double vision, patient having blurring of vision, sudden onset, patient can have facial drooping, there is facial asymmetry, patient can have arm weakness, patient can have slurring of speech, sudden onset. So sudden onset slurring of speech, sudden onset hand weakness, sudden onset facial asymmetricity, sudden onset patient is having difficulty in seeing objects, sudden onset difficulty in balance, patient is having difficulty in balance while walking. So all these can be due to stroke. So if you are suspecting a patient having a stroke, so patient should reach hospital as soon as possible. So finally summarizing, what is stroke? It should be sudden onset, it should be vascular cause, either vessel is blocked or either vessel is rupture, or depending upon which area of brain is involved, patient can have different symptoms. So this is B fast mnemonic. B for sudden onset balance problem. I stand for sudden onset eye problem, which can be double vision, difficulty in clear vision, vision problem. That is I. F stand for facial drooping, sudden onset facial asymmetricity. That is F, facial drooping. A stand for arm weakness or leg weakness. Then S stand for sudden onset slurring of speech. Then T stand for it's time to call. We should reach hospital as soon as possible. So we should reach hospital as soon as possible. So now patient has come to emergency and we are suspecting patient is having stroke. So first, what is the basic investigation? First investigation we have to do in a patient we are suspecting having a stroke. We have to do NCCT head. So we will be doing NCCT head of any patient having suspecting stroke. So what are the possibility? Either it can be CT can be normal, but we have clinical suspiciousness of stroke. So it can be stroke mimic, like malignancy, hypoglycemia, seizure. All these are the conditions which can mimic stroke. So all these are stroke mimics. Or patient can have abnormal CT, which is either ischemic stroke or hemorrhagic stroke. So how hemorrhagic stroke looks on CT scan? So any white thing on NCCT head, it can be calcification or bleed. But as we are suspecting, patient is having sudden onset neurological symptom. So NCCT head, which is showing any white thing, is likely bleed. Patient is having hemorrhagic stroke. So now patient has come to emergency department with clinical suspiciousness of stroke, and we have done NCCT head, and NCCT head is showing white thing, which is hemorrhagic stroke. So now patient attendant will ask from doctor, doctor, is my father serious? Is brain bleeding still happening, or it has stopped? How much bleeding has happened? Whether it's 20 ml, 30 ml, 40 ml, 50 ml, how much ml bleeding has happened? And can we give some medicines to control the bleeding, or we have to do surgery? So we have to respond to these questions to patient attendant who has come to emergency department with hemorrhagic stroke. So we are going to answer these questions one by one. So what is ICH? ICH is a type of hemorrhagic stroke, intracerebral hemorrhage. So bleeding inside the brain. Bleeding inside brain can be in the brain parenchyma or can be inside the ventricle. So it can be in the bleeding in the brain or bleeding in the ventricular system. This is known as IVH, intraventricular hemorrhage. IVH. So ICH, which is intracerebral hemorrhage, is also known as spontaneous ICH or non-traumatic ICH or primary ICH. All these are same things. So patient has bleeding inside the brain. Why it is happening? Either pressure is increased in the blood vessel, so that is causing bleeding. It can be due to hypertension, which is the most common reason of bleeding inside the brain. Patient has raised blood pressure, or it can be due to cocaine, amphetamines. Patient is ganja smoker, substance intoxication disorder. Patient can have CVT, which is cortical venous thrombosis. If vein is blocked, then the pressure in the capillary will increase and it will rupture. So patient can have bleeding inside the brain due to increased pressure inside the brain vessel. Then it can be due to blood vessel is weak, due to vessel wall is inflamed like CNS vasculitis, amyloid angiopathy, vessel wall is weak, then bleeding can happen due to wall weak, or it can be due to aneurysm, wall is dilated, or it can be due to arteriovenous malformation, AV malformation. It can be dural arteriovenous malformation. In all these conditions, blood vessel wall is weak. Why? Then the other reason why bleeding can happen, because blood is very thin, due to like patient is on ecoaspirin, on antiplatelet, on clopidogrel, on warfarin. So all these are the reason why bleeding can happen inside the brain. So it can be due to increased pressure, which is most common reason. Hypertension can be due to blood vessel wall weak, which can be due to amyloid angiopathy, CNS vasculitis, AV malformation, aneurysm bleed, or it can be due to thin blood, which can be due to coagulopathy.